for today's discussion, I'll be talking about the Affordable Care Act and how it affected the community when it was released and implemented. So the Affordable Care Act initially was enacted on March 23rd, 2010, and was designed to improve the standards of healthcare, expand healthcare for insurances, and control costs to enhance the quality of the overall insurance and healthcare in the United States. The Affordable Care Act was planned to be put into play for the first time on January 1st, 2014, and by this time they had had a few years to critique and fix the problems that were originally put out. The goal was to allow everyone to have access to health care because there were several lower income families and even middle class families that still couldn't afford health care. And not only to make healthcare affordable, but so everyone had access to healthcare, no matter who you were or what was going on. The goal and the biggest perks was that insurance companies could no longer deny a patient because of prior comorbidities or any previous health problems. And this was the big thing then. The insurance would deny you because you had diabetes or you had a previous issue that they knew was going to be expensive to take care of, and you were going to have multiple health visits and see many specialists to, manage the outcome of your disease. So the biggest perk to this, aside from that, was also there were cuts on how much patients were paying out of pocket. There were limits, and this also allowed patients to stay on, young adults to stay on their parents' insurance until the age of 26. So it gave them some time to go to college and do all the things that they needed to do prior to needing to carry insurance on themselves. And this was hopeful to provide good health care for the future. The second is access to care. One of the most significant things about implementing the Affordable Care Act was there were increased access for care of the people in your community. Anybody was able or eligible to receive insurance no matter what your yearly income was. And also, by not denying patients, this allowed people to make primary care visits and annual specialist visits and not have to look and seek care at the emergency department because that was the only place that wouldn't deny them. And this also allowed them to see someone prior to needing having an emergency, and they were able to manage their disease a little bit better. Third is cost of care. The Affordable Care Act was aimed at reducing the burden of out-of-pocket costs for individuals and families after receiving health care. For many families, this was great. The cost had went down and they did have less out-of-pocket cost, and for others the cost was still unaffordable. This left a lot of lower income people obviously receiving Medicaid and was able to afford all of their healthcare problems, visits, and emergency department visits. The more middle class, this left them to where they might not be able to afford something because they were still paying out-of-pocket costs. It wasn't completely zero. This also was implemented with insurance companies that it covered annual visits, preventative care, and all vaccines, which was big, so that kids were allowed to receive all of their vaccines for free, so on and so forth. And, everyone can get the flu vaccine and the yearly things that people get. Again, some of the downside of it was some families didn't always qualify for the specific premiums that had cuts, and they still ended up with astronomically high premiums that they couldn't afford, so they were still ending up going to the emergency department for last minute care. Fourth is the quality of care. Overall, any act or law that is put into play is to improve quality of care for the people and the communities that these facilities see. At any hospital you work at, you always want to offer the standard of care and beyond. You want to be the best. And of course, that's why there's so many reviews and statistics and things that allow us to have reasonable things to say, we should do this next time, or we could do this better, we might not be so good here, we need better communication between staff, or we need better transition between staff and shifts and things like that. The Affordable Care Act really pushed for just overall better quality of care that were being offered at the facilities. One change that was really noticed by people was that people started recording the outcomes of the patient outcomes after their stay at their facility. So they were able to go back and divvy down exactly what happened, what you could have done better, and why we should do this the next time. According to one of the journals that I had read about, Hewitt, these statistic reports have drastically changed outcomes for patients over this last several years, and this is now a standard of care that every hospital reports these outcomes, and they look over them and there's specific positions to set that bar for the standard of care across the board.